Good evening, everyone. Thank you for being here for the second in our series of initiatives for the Million Cat Challenge, Managed Admission, giving shelter cats their best chance at a great outcome. I'm Lynn Fridley, Program Manager for Maddie's Institute. Our speakers tonight are Barbara Carr, the Executive Director of the Erie County SPCA, and Kathy Johnson, the Senior Director of Operations at Animal Humane Society. Together, Barbara and Kathy have over 35 years of sheltering experience, and both have been very successful with their managed admission programs, which you will hear about tonight. Before we start, let's talk about a few housekeeping items. Please take a look at the left side of your screen where you'll see a Q&A window. That's where you'll ask questions during the presentation. Our speaker's presentation will be short, allowing more time for questions, but don't hold them until the end. Questions asked in the last few minutes will probably not be processed in time for a response. If you need help with your connection during the presentation, you can click the Help widget at the bottom of your screen. Also, the green File widget contains the presentation handout and a printable certificate of attendance for people attending this live event. So be sure to download, save, and print. Barbara and Kathy, thank you for being here this evening.
Thanks, Lynn. It's really a delight to be here, and I thank all the participants for coming on and spending the evening with us and learning more about managed admissions. So we've been involved in managed admissions for a while, and the question I always have for people is, what are you doing now to help cats? And I think just basically the fact that you're on the phone tonight shows me that you already agree with me that we owe it to cats to try different ways to save their lives, and that we have to challenge our fears of the unknown to help cats out, or cats will suffer for it. You know, and up here in the Northeast, we really don't have a dog problem, and there's no excuse, particularly in the Northeast, not to try everything we can to save cats' lives. So with that in mind, we're going to be talking about managed admissions tonight, and I do hope that you'll be joining the other 5 initiatives as well. So with managed admissions, by using this as a tool, you really can control the population in your shelter, which really allows you to control the disease, adoptions, length of stay, upper respiratory disease, unnecessary euthanasia, and more. For us at the SPCA, our diving into managed admissions happened beginning in August 2009. We had every cage in our building filled with cats, and we had overflow cages in our multi-purpose room. It was an unbelievable amount of upper respiratory going through the building, and 75 of these cats in a room that wasn't even 4 cats, our multi-purpose room, and then we got panleukopenia. 39 of the 75 cats in that room died. That was the real wake-up call for me that something absolutely needed to be done. And this is when I believed that we had no excuse whatsoever to have cats dying in the shelter because we were afraid of someone abandoning them in the field. In fact, it's an unacceptable practice to have cats dying in your shelter when you have any other options available to you. So we were concerned with many of the things I'm sure you're going to be concerned with: daily arguments with people, cats being dumped at admissions, bad press, cats in boxes outside our doors, and many other reports of cats abandoned. And to our great surprise, none of this came about. The public absolutely supported our efforts to save lives. There was no question when we asked people if they would mind going on a list and wait their turn to come in that we could save more lives. They were with us. There was no increase in arguments from people. There were no increases in the number of animals dumped, and no significant decrease in the total number of cats admitted to Erie County agencies. In fact, there wasn't any decrease at all. So first, all we did was put people's names on a list, and we called when we had room to bring in their cats. We prepared ourselves for the negative feedback that we were sure was going to come. Of course, we found very quickly that that didn't come. But in the first year, our waiting list at one time had over 600 cats on it. That was really a scary, scary time. But by February, the list was empty and no waiting time was needed. That lasted probably about a month, and then the waiting list started in again. Once we started a waiting list, it only really took about 2 weeks for the public to catch on and begin calling to make appointments. It's really a rare occasion when somebody just walks into the shelter with a cat and wants to give it up. And that happened fairly quickly. It was a real surprise to us. And while we had the people on the waiting list, and sometimes it was for a very long time, we did everything we could to help them. And particularly, we encouraged them to keep their cats. We offered to sterilize. We offered free food if that was the problem. We provided access to vaccines, affordable medical care, and we provided behavior advice. In our first year, 8% of those waiting to bring their cats in chose to keep their cats. And in that first year, that amounted to over 70 cats not being admitted at all to the SPCA. And that's really a substantial number. The other things that happened in the first year, 62% of the cats on the list were admitted. 8% of the cats with the appointments to be admitted never showed up. 8% were kept, as we saw. 12% of the owners successfully rehomed the cats on their own. And it was an unknown outcome for 10%. We were never able to reach 10% of the people after their first initial call into the SPCA. So today, this past year, our waiting list maxed out at 301. So obviously we've gotten better at managing our list. 280 of the cats and kittens that were on the list were sterilized and kept in 2014. So that's quite a jump up from the 70 that was in the first year. One person, 16 hours a week, handles our waiting list, and she's absolutely wonderful, and no, you can't hire her. We keep in contact with the owners on a regular basis, and the public continues to be supportive. I think that honest communication with them is the key to our success, making sure that we communicate with them, making sure that they know where they are on the list, making sure that they understand that it might be a substantial wait or it might be a quick wait. But whatever it is, we want to be as transparent with the owners as possible so there aren't any surprises for them. Last year we had 1,877 cats on the list from 789 homes. So you can see that many of these homes were multiple cat homes, and people were feeling a bit overwhelmed. So here are some surrenders by reason, and I think that these are pretty common reasons that you see as well in your shelter. But you'll see that that big orange block, that represents people who just felt that they had too many cats. And that goes right along with what I was saying about the 1,800 animals coming in from 700 or so homes. So that seems to be the problem, and that's where we've probably had a great deal of success by offering spaying and neutering so they don't get right back into that same situation. And here are the outcomes last year for this waiting list. So 274 of the families rehomed the cats on their own. 162 kept their cats. 155 were unreachable. 762 of the cats came in, 117 no-shows, and then another agency took cats, 74 of the cats, and 280 were spayed, neutered, and kept. So there was 280 that we sterilized, and they kept those cats, plus the 162 cats that people kept on their own. So I would say that that's kind of remarkable out of the 1877. If you add those two figures together, it's a pretty big proportion of the animals. And 53, when I made this list, were still awaiting intake, and I believe that was January 1st information. So our length of stay for cats in the shelter in 2010, right after we started this program, was 35 days. That was for adult cats adopted, 35 days, and by 2014 that dropped to 23.4 days. So we're saving almost 12 days on length of stay for cats by just this one program. And I think that you could see that that's a pretty great deal, and obviously it's going to save a lot of money. If you look at the animal care days reduced by shortening the length of stay, we went from 52,000 care days in 2011 to just 36,920 care days this year. So that's a substantial amount of days that we didn't have to care for a cat. And even if you figure it's $5 or $10 a day for a care day, that's a lot of money saved. Our URI, upper respiratory infection, is down by 13%. I actually think it's down by quite a little bit more, but it's hard to pull accurate information without going case by case on every cat, because if there was something else that was listed as a reason, it would be difficult for me to pull out that information. And you can see that our total cat intake by year has gone down, but over Erie County, and I have all the figures for Erie County, the cat intake has actually risen about 3%. So when I include all the agencies in Erie County, we are not taking in or serving fewer cats in our county. We're serving more. We're just doing it without cats getting so sick, without losing so many cats through diseases like panleukopenia. And I will say that last year we did not have one case of a cat dying of panleukopenia. So again, I think a major change from when we started in 2009. And our adoptions as a percentage of intake of adult cats is up 8% from 2011 to 2014. So I think not having the cat room so crowded and so overwhelming to our visitors, we have also seen an increase in our cat adoptions. So I'm going to pass this back to you, Lynn.
Okay, thank you, Barbara. That was great. We do have a poll question for you in the audience. You will answer this poll right on your screen, not in the Q&A box, but right on your screen. Does your organization manage admissions? And if it does not, have you been convinced to start doing so now? And your choices are: we already manage admissions and it works. Yes, we are convinced and will implement these changes to admission. No, we're not convinced yet. Tell me more. Don't know or not applicable. So please answer on your screen. I also would like to remind you to get your questions in. After Kathy's finished speaking, we will go to the Q&A session of this webcast, so please get your questions in as soon as you can. So let's go and see our results. Wow. Kathy, 42% are already managing their admissions, and it works. And Barbara, you've convinced 13% of the people that they're going to change, so that's great. So I'd like to introduce Kathy for the second half of this presentation, and then we'll go to your questions. Kathy, it's all yours.
Fabulous. Thank you so much. I'm really excited to be here, and the 8.3% that want to hear more, I'm going to convince you that this is the right thing to do. So I'm really excited to be here and share our journey and why we moved to managed admissions. So I really want to share why we did it, how we did it, and of course the results that you've seen or that we've seen, and truly just the benefits to both the people and the animals that we've realized. So one of the things that kind of started this whole thing was we had UC Davis did come and evaluate our 5 shelter locations. And they came up with a lot of different ideas that we packaged into a strategic initiative that we called Bound for Home. And you can see all the different components there. And one of them certainly was surrender by appointment. Why we were doing this, we had a huge disparity. Like Barbara mentioned, there's really not a dog problem here in Minnesota, but there's a cat problem. So we had a huge disparity with the numbers of cats that were coming to our shelters. We have 5 shelter locations, and the number of cats that were actually going out into homes. We literally had over 20,000 cats coming in every year, and around 10,000, 11,000 were going out or being placed. We weren't proud of those statistics, but we were doing the best we could at the time. Every year we tweaked a few things, did things maybe a little different, but we never really saw changes, and those same challenges remained. So we really kind of realized that if we wanted to see different results for cats and provide better care for cats, that we had to do something completely different. And that's what, when we started hearing about managed admissions, we knew that that was the place that we wanted to move to. So we moved to managed admissions not only because of the problem with our cat, but one thing that we realized was that this isn't an Animal Humane Society problem. This is really a community problem, and we felt strongly that we needed to partner with the community in order to make things better. We couldn't do it on our own. We do still consider ourselves an open admission shelter. We don't turn animals away for health or behavior. And kind of what our motto is we may not be able to help you today, but we will help you. So again, we don't feel like we're turning our backs on our community or people that need our services. We're just doing it in a different way. So I want to take you through kind of what our process looks like. There are so many different approaches to implementing this process, so I'm just sharing with you today what works for our community and what our goals were. We went and visited a lot of different shelters that were doing different versions of managed admissions, and we couldn't really find one that was exactly what we're looking for, but we took a lot of great ideas from a lot of what other shelters were doing and put them into a program that would work for us. Our goal was really to remove any barriers that we could to an animal getting to adoption. So our process, we actually have the customer or the owner of the animal actually stay and wait for the appointment, and they actually wait and hear the results of the evaluation, and then we work together to find a solution to the best next step. So I'll go over that in a little bit. This slide is basically just showing, again, we have 5 different shelter locations, so we have varying numbers of evaluation rooms. You can see our appointment times. We do have our vet techs, again, do the appointments. One vet tech will do the feline and the critter appointments, and a vet tech and a behavior tech will actually do the canine appointments. We designed all of our rooms to be able to do that in one area. So our technicians can be extremely efficient working with the customer and then providing great customer service. So what we did is to get these phone calls is we developed what we call our Animal Admission Center. It is a centralized call center that takes appointments for all 5 sites. We found that this was a great service to our customers. So one representative, if there was an appointment at one of our shelters, they could find an appointment available at a different shelter. So that was extremely helpful to our customers. Our average number of calls is around 4,600 a month, but I will say that during the heavier intakes months, it goes up quite a bit. I think we average a little over 6,000 calls a month. I have wait times on here, and we don't have a waiting list, so to speak, but the time that a person calls till they can actually get appointment is what I'm indicating here. So during the winter months, 2 to 3 days is usually all it takes that we can get someone in. During the summer months, however, when again the number of cats needing our services increases and kittens are around, people will schedule out appointments 2 to 3 weeks. So to clarify, we've never had a waiting list. We are able to schedule appointments, and this is the wait times that people would have to wait in order to get an appointment. What we wanted to accomplish with this phone call is having a conversation with the owner and trying to understand why they were surrendering the pet, and then hopefully offering resources to help them keep that pet in their home or help them solve their problem in a different way. We always want to be accessible to our clients, but a lot of times what we found was that people weren't even aware of different resources that were available to them, and this is what it was all about. So if making an appointment and surrendering the animal to us was the best option for this animal. We would schedule the appointment. We would ask the person to go online, fill out an animal profile, and of course try to get their vet records if they could. I do want to mention that if the pet is clearly not adoptable, and these have to be kind of extenuating circumstances, say a dog has severely injured a child, that's not placeable through our shelter. So that person would be counseled with either other resources to deal with that behavior, or we would offer them an appointment, but it would have to be a euthanasia appointment and not a regular appointment for evaluation. So again, as I mentioned earlier, when someone actually comes in for the process, our intake evaluation team admits the animal. They bring the client into one of our evaluation rooms, and they have that first conversation where they're talking about why they're surrendering the pet, looking at the profile, asking questions. I'm just trying to clarify and getting them as much information on that animal as we can. The behavior evaluation and the actual physical exam are done at the time appointment, but we escort the client or the owner back into the lobby, and we do that evaluation while the owner is not present. We find that just works a lot easier, and the animals behave a little better. But then what we do is when the results are done, the evaluation is complete, we bring that client back into the room and we have a discussion. And again, we really go over what are the next steps, what are we going to do. If the animal is placeable, we proceed with that. If the animal is not placeable for whatever reason, we can have conversations with people about what other resources that we could offer them to help them work on that medical or behavior problem, another resource for them. So again, even though we're not always able to place the animals, we do try to remain a resource for our customers and provide them with what they need, even if it's not exactly taking the animal in and finding a home for it. So some common questions that we get are how we handle different scenarios. So I will say for our organization, we made the decision to take strays. We are the largest animal welfare organization in our community and in our state, so we didn't feel it was appropriate to stop taking strays. So we do continue to take strays at all 5 of our sites. We encourage appointments, but we do not require them. So we try to offer resources for people to, keep that animal in their home if they need a litter box or food, until we get an available appointment. But if someone really pushes back and really can't keep the animal, we, of course, will accept that animal as a walk-in. All of our foster returns and rechecks are scheduled by our admission center and are brought in through that appointment process. Because remember, this is managing the number of animals that are coming into your shelter, so we had to account for the hundreds of animals that go out into foster but then have to re-enter our system. One of our shelters does accept wildlife. We don't require an appointment. But if someone calls, we can advise them which shelter to bring and then give that site the heads up that someone's coming in. And the other thing is that we do offer euthanasia by request as a service to our community. So those appointments, if someone calls in, of course, we schedule that as an appointment. If someone just walks in, of course, we would accommodate that person because they're in a situation that they need our services immediately, and we don't want to make them wait for an appointment. Initially, when we first started this process, and this was back in 2011, we started this. When people would come in, we would explain our new process, encourage an appointment, but we wouldn't necessarily hold people. We would, accommodate them if they push back, and we'd just get them into our system. What we realized 6 months after doing this process is that we would never achieve our goals of truly managing our admissions if we continued to allow owner-surrendered walk-ins. So after 6 months, we started having the staff tell people that we do require appointments. Now, certainly if it was an emergency situation, if the person or the animal was in dire straits, we would accommodate that walk-in. But for the most part, owner request or owner surrendered animals, we were saying keep that animal in your home, and we'll schedule an appointment. Knowing that that animal was safe and being cared for, we were comfortable doing that. And of course, strays, and to this day, strays we do still accept as walk-ins. So wanted to share some statistics. We are extremely proud of these, and I've been with the organization for over 13 years, and I will be honest that I never thought I would see these kind of results for cats in my tenure with the organization. So you can see that our intakes, and these are our total intakes, that first line dropped significantly. We talked about the feline intakes, how it went 20,000, now we're down to 12. Our adoption rate has increased. Our live release rate has increased. And as Barbara mentioned, our URI has dropped dramatically, and I think that's been the most impactful. And you can also see that our length of stay went from over 31 days down to 11. And it's all about managing our admissions, being able to give animals what they need when they walk in the door. So an animal can come in literally into our appointment system. It can get put on the adoption center within hours and get adopted if it's sterilized and go home that same day. And that was really our goal and what we wanted to achieve. I will share as well, as Barbara did too, we got minimal pushback from our community. Now some people did, as you always will have, some people will not agree with what you're doing, but by far the majority of our community embraced this. When we explained why we're doing what we're doing, they felt good about it. They were okay with waiting. They wanted to partner with us, and we were really, really, really happy by that response. And as I'm talking with other organizations that have moved to this process, they're seeing the same thing. So I really think this is a great example of that we in animal welfare need to assume the best of the people in our community and the people that are calling us for services. They want to do the right thing. Our call center statistics, as Barbara was sharing as well, what we started to do was really track what we were doing. So we knew the number of animals that were actually coming into our shelter was reduced significantly, but we were still impacting them. So you can see, like, we referred them to the behavioral helpline. 358 people did that. Over 1,000 people decided to keep the animals. So we were keeping tracks of these. And when you look at the very bottom, the number of the people that we helped in 2011 is equal to the number of people we helped in 2010. So we strongly believe we're still helping our community. We're just doing it in a different way. And you can help your community by not necessarily bringing the cats into your shelter. There's different ways that you can do that. I wanted to share, too, is that we do make reminder phone calls for our appointments. Our no-show rate was initially closer to like 20-25%. Once we started making those reminder calls, a lot of those reminder calls turned into cancellations. And then we were able to reschedule those appointments. And again, our no-show rate just dropped. So it is time and staff intensive, but it's well worth the investment because your no-show rate will drop definitely from that. So we wanted to ensure that we weren't pushing this problem to our other local animal controls and rescues in our area. We tried to get statistics. We weren't very successful at that, but we were, having conversations with people. A local animal control did start seeing a little bit of an increase in felines, so then we partnered with them. We started taking felines from them on a weekly basis when we had room in the shelter. We still do that to this day. Now, sometimes in the summer when we're a little heavier on cats, it doesn't always work out, but we do try to, help as much as we can. And that's a great opportunity when you do this. So in wrapping up here, internal benefits, for the first time our wards were not filled to capacity. Our URI dropped, staff morale was better, our volunteers were happier, and our cats were happier. They were happier and healthier, and that did equate into more adoptions. We're finding now that we're able to place more animals. We're now placing animals. We're treating ringworm. We're placing animals with leukemia and FIV. These are things we could never do before because we just had too many cats in our system. And as I just mentioned, I think, a big thing is being able to help your community. So we certainly are always concerned about our own statistics, and we want good results for our shelter. But then you have to reach outside of your walls. And by moving to a managed admission process, this has allowed us to help more animals, not only that are directly coming to us, but with other shelters and rescues in our community. So that's a lot of information, but that is our journey. I hope you found this information helpful, thought-provoking, and hopefully it's drummed up some questions. So I'm going to pass this back to Lynn, and we can open it up for questions.
Yes, we have a lot of questions. So I'm going to push the first question to the slide area, and here we go. Do you ever encourage the people who found a stray to foster the animal until space opens up?
All the time.
Yep. Always.
So that's an always. Okay, great.
We are moving away from accepting healthy strays.
Okay, excellent.
As well.
Excellent. So they're also encouraged to foster them or adopt them or something to that effect. How do you handle that, Barbara?
Well, we do a number of things. We say if you'll hold on to the cat and then you decide you want to keep it, we'll spay it for free and give it its vaccines. There won't be any adoption fee. So we throw in as much encouragement as we can. We will take any cat, stray or owner surrender that is in medical need. We're not going to turn our backs on animals that need us, but I think there's enough information out there that says the worst place a stray cat, or really truly stray cat, can be is the shelter. It's not nearly as likely to get home and as if it's left where it is. So, people, again, as Kathy was saying, we underestimate the public all the time. They are so willing to help us with this and so much more understanding than we would ever think they are.
Great.
And
Thanks, Barbara.
If I can just add,
yes.
we do the exact same thing. So we try to encourage people to keep strays, and we also on our website we host a lost and found page that anyone in the public can use. So we encourage people to keep that animal. We encourage people to try to find that owner on their own. And it's amazing how many people will end up keeping the animal, or and as Barbara said, they're willing to wait. They're willing to keep that cat until space opens up. But yeah, I think again you have to just trust the community that they're going to do the right thing, and don't be afraid to ask, because most of the time the response will be positive and people want to help.
Thank you both. We're going to push the next question to the slide area, but I do have to announce that we have Dr. Julie Levy on the line, and this may be a good question to start off for her. Are there any municipal animal control facilities managing intake like these nonprofit examples?
There are some, in the sense that they're now scheduling hours for intake rather than being open 24/7 for intake. Sometimes it's just a couple days a week or certain hours, so that animals are coming in when there's more likely to be room in the shelter. I'm not yet familiar with a shelter that is, well, actually, no. We have a veterinarian visiting us right now from Miami-Dade Animal Services, which is one of the 10 biggest municipal shelters in the country. They take in over 30,000 animals a year. And they now have what they're calling a deferral program. So when people want to bring in an animal, it comes in, they vaccinate it, and then they put it on a waiting list to come back in, so that when it does come in, it's immune to diseases, which makes it safer. Also, in the meantime, they are working with the finder or the relinquisher to find an alternative to shelter intake. So sometimes that's providing medical care that the shelter pays for. So for instance, if there's a treatable condition, the shelter will provide the medical care and then give the pet back to the family. Or they'll ask that they have the greatest thing now I just learned about. It's the Milkman Project. So they have 2 officers that go out and support this deferral program to either bring food or do other things to keep pets in the home. But one of their new initiatives they just started is when they get calls about neonatal orphan kittens, they are delivering kitten care packages that consist of a bottle, milk replacer, and the Snuggle Safe warmer. So it's a whole kit that is delivered to the door by an animal control officer to help that person who found the little orphans raise them up until they're old enough for adoption, and then they can come into the shelter.
Excellent. Shall we go to the next question? Here we go. This is a good one. Understanding that this is a cat-focused webinar, if either of you have any examples of how managed admissions can be working for agencies that have high incoming dog populations or other species like rabbits, etc.
I can take a stab at this one. I mean, our both of us have the same problem where it's our problems are directed around cats, but I feel like the same philosophies still apply to dogs. Cat owners or dog owners, I mean, people still care for these animals and want to do the right thing by them. So I don't see a difference why it would be different for a dog or cat or rabbit or any of the different species, because the philosophies are still the same. You're asking people to schedule a time to come in versus just bringing them whenever they want. So the same support I think would have to be given to the dog population, as rabbits and whatnot. It's just I think the support that you need to provide people. But again, I still feel like the same philosophies still apply on this one.
And I would say, this is Barbara speaking, we do keep a list for rabbits as well as cats. And from time to time, and it's very rare, we will have a dog waiting list. It doesn't last very long. But interestingly, today we had a discussion at our staff meeting about how it would make a whole lot of sense, even though we don't have an overcrowding problem with dogs, to move them into an appointment-based intake, because that way we could really manage their whole intake process a lot better and have it be a lot less stressful if we knew exactly what dogs were coming in when. So we're actually moving to managing dogs, even though we're managing their intake for very different reasons than we are for cats.
If I can share this with Kathy again, so we do right now manage dog appointments, critter appointments, everything through our managing process already. So that's what I was trying to show, like we have different appointment times. So we are already doing it. So to what Barbara was saying, even though we have different reasons behind it, we are still doing that as well.
Excellent. Let's take the next question. How do you get shelter management to open their minds to change? Where I volunteer, they just want to do the same old stuff that they've been doing for years. And a lot of it just doesn't work anymore.
Well, I'm the shelter management, and I'm always being accused of being addicted to change. So I don't, I really don't understand leadership that doesn't want to look for improvement, because certainly I think in my opening slide I'm talking about what are you doing now and how's that working for you. And I think that that's a question that everybody needs to ask themselves at whatever level they are in at a shelter. What am I doing today with the animals in my care, and how's it working? And if it's not working, what can I change to make it work better? And, keeping that front and center, I think, is really the thing that can lead to change and progress.
And another suggestion might be, if I can jump in here, is try to get your shelter management to watch these webcasts. Maybe it'll convince them that change is needed. So I'm going to go to the next question. You said that people almost never bring cats in without calling you now. How did you get the word out so effectively to people that this was the new policy?
I think that question is for me. This is Barbara. I've thought a lot about that, and I wonder if they didn't call before, we just didn't notice. We would just tell them what hours we were open and, tell them what to bring with them and what have you. But maybe they were already calling, and we just didn't notice. Does that make sense?
Kathy? Yes, that makes sense. Kathy, do you have anything to add to that?
Yeah, I think, we do a lot of, we didn't do any broad communication of this, media events or anything, but we posted it on our website, and I think that we had it anytime we were talking with, a stakeholder in our organization or a customer, we were sharing this, and we were just trying to spread the word. So again, even when people would come into the shelter, they would hear, well, you have to make an appointment now, so we would try to work with them. So I think it was just that, it's that constant constant and consistent message that this is what we do now. Our website does get a lot of traffic, so we had it all over there. For months, it was the first thing when you clicked on our website, that was the first thing you saw. And again, I think it's just, sharing with our, of course, our staff and volunteers knew, they were spreading the word. So we didn't do anything other than the way we normally communicate, but it was that constant and consistent message, I think, that made the difference.
Very good. So here's a good question for you. Are there any written materials, forms, procedures, etc., available from your program that could be adapted by others?
Well, I know that Maddie. Go ahead, Kathy.
Go ahead, Barbara. No, go ahead, Barbara.
Go ahead,
well,
Kathy.
I know that we have a booklet that is on the Maddie's website that you can download, and it will give you just a few ideas about putting together a managed admissions program.
And I would add that we have the same. Again, we have 5 shelter locations, so we do nothing without a form or a procedure or a protocol. Just with that many shelters, we have to have it. So we don't have those posted anywhere, but if you reach out, I'm certainly willing to share whatever we have that can help someone make this transition a little bit easier.
Excellent. Thank you. Barbara, what do you think happened to the people on your waiting list who were no-shows? Did you follow up?
Well, in the one case, we did follow up, and we weren't able to reach anybody. There were phones disconnected, or they weren't the right numbers, or whatever. And then on the ones who missed their appointment, I think that some of them we rescheduled. Some, they fell into different categories, but they were statistically, number one was that they didn't show up. Now, they may have made a new appointment and shown up at that appointment.
Okay, great. Here's another question. What did you do with the cats people said they would not care for until space was available? Did you get a lot of these cases?
Well, I don't think we get tons of them. Oh. Kathy?
Oh, okay, sorry. We as Barbara was, I think, just about to say, we don't get a lot of people do that. I think, our biggest thing is people that find strays, and if they're not able to keep them until an appointment, then we will certainly take them in. But with owners surrendered, again, unless there is really, a dire emergency, that family, we do ask them to wait, and we do this by explaining to them why we need them to wait, why we can't take any more cats, at that particular time, and ask them to make an appointment. And again, most of the time, people are very accepting of this. When they understand the challenges that we're having, the benefits to that animal will be if they wait. Most people are fine with it. And, again, you have to have that conversation. But the majority of the people will come around. And just schedule the appointment and wait for that appointment.
And I think Kathy will agree with me when I say that probably the most surprising and delightful piece of this whole trip is to find out that we're not alone in it. That every time we talk to someone of the public who has this need to get a cat into the shelter, they want to work on this almost as badly, or sometimes more than we do. I mean, they're really great partners, and you're just going to be amazed if you're not seeing this already, that people will do whatever it takes to save these cats' lives.
I couldn't agree more.
Great. Here's another question. Are there other shelters in the area that would accept cats without an appointment during this time? And if yes, did their intake of cats increase?
I'll start. We do have a municipal shelter, and you don't need an appointment to take a cat there. If their intake increased, it wasn't by a great amount, and they were able to handle that. With the agencies, we have many partners in the community that we've had for some years now, and we try to help each other as much as we possibly can. And if the city animal shelter couldn't take one more cat, the word would go out to everybody, and everybody would step up to the plate and take one or two or whatever. And we've managed it. So it's not just the public that you need to be good partners with. It's your other agencies in the community. It really has been life-saving.
And everything that happened in Barbara's community happened in ours as well. So we did partner with our, the local animal control. There's an animal control, 5 miles from the shelter that I'm sitting in right now, and they did see a little bit of an increase. So we kept in conversation with them, and like I say, we do take cats from them when we can because we weren't trying to just push the problem off on someone else. This is a community problem, so you can't do this, I think, in a vacuum. You have to create partners with your community, and you have to create partners with the other agencies and shelters and rescues in your community as well.
Okay. Very good. Here's another good question. How does your organization pay for the veterinary care that the sick animals you receive?
I'll start on this. We pay for it through effective fundraising and development within the community. Again, I think that the closer we get to partnering with the community, the more they support our efforts and understand what we're doing. And, we did have a Maddie's grant, which helped a great deal, but that money is gone, and we have continued to talk to the community about the medical needs that the animals in our care have, and, we've gotten the support from the community to continue the level of care that we had when we did have a Maddie's grant.
And I would add that I absolutely agree with Barbara about the fundraising piece. And I think one thing that we realized is that your intake goes down. You have fewer animals that you're caring for in your shelter, whether they're moving faster or you're just not taking as many, and that does free up more resources. So we see a significantly fewer animals, but it doesn't mean that our budget for veterinary care has decreased. We're just able to take the money that once was spent on all these cats, and we're able to apply it now to animals that need more services, be it medical work, behavior work. They need to stay in the shelter longer. They need significant work. We have the money to pay for that now just by that drop in the number of animals, and again that continued fundraising. We speak to what we're doing, the changes that we're making, the advances, how we're able to help animals differently. We speak about that all the time because we're proud of it. And it's also, as Barbara was saying, that's that fundraising. Like, people in your community need to know what you're doing, how you've changed, and really get that message out there. And I think the community gets on board with that, and then your fundraising dollars go up or maintain the same even though you have fewer animals, and you're able to provide so much more than you were before.
Right, and this is Barbara again. I do want to say that if someone from the public wants to surrender their cat because they can't afford to treat it for something that's relatively simple, or they can't afford to spay and neuter it, those are probably all things I'm going to be forced to do if they bring the animal to me. And then on top of that, I'm going to have to pay for the 22 days it takes me to adopt that cat out. And if that's $10 a day, that's another $220 to get that cat out the door. So why wouldn't I cut my losses of that $220, do those services for them if they are willing to keep the cat? And it's what they want anyhow. They really want to keep the cat. They just can't afford that spay-neuter or that worming or that vaccination or whatever it is.
A great answer. Here's another question. It's aimed at Animal Humane Society. How did Animal Humane Society prevent owned cats from being relinquished as a stray when a client didn't want to wait for an appointment?
We don't, essentially. There could be people that are saying that these cats are strays, so they don't have to avoid an appointment. Again, we just try to assume the best out of our customers and our people in our community. We tell them why we need to make an appointment. So if people are trying to skirt the system, and again, it could be very possible that it's happening, we don't know that by any means, and we just are going to assume the best, that people are being forthright with us. There's nothing that we could do. We certainly don't want to accuse our customers of lying. I mean, it's hard to prove that, and again, we really just want to be able to help that animal. So if someone feels they have to go to that length to get in to see us, then so be it. We just don't focus on it, and we just don't make a big deal out of it. And again, we don't know if it's happening or not.
Okay, great. How do you, here's the question, how do you define limited admission versus managed admission?
I'll take a stab at this one. I feel like, as I mentioned, like we still consider ourselves open admission, because just because we have people wait for an appointment, we're not limiting or putting any barriers or saying only certain animals can come to us. We still would accept every animal that comes to us. It's just that we do it in a more formal fashion now versus just letting people come to the door and drop them off as we want. So we really don't feel like we're limited admission. We are still, again, accepting every animal. The only difference is that we're asking that drop-off to be scheduled versus just coming in anytime they want.
I would say that I see limited versus managed in sort of the same way. Limited means we're going to limit it to this, this, and this, and managed means we're going to manage how the animals come in for their best result and the best result of the organization.
Very good. Do you always run the wait list chronologically, or do you ever accept your next animals based on the breed, color, age that you currently have in the shelter?
We do. I don't know about you, Kathy, but we also have incorporated fast tracking into the shelter. For instance, there's no wait list for kittens. I know that if I take a kitten in, I'm going to have it go right back out. So they hardly ever go on the wait list. Declawed cats, we always let those come in pretty quickly because there aren't very many of them and people always want them.
So while we don't have a wait list, so to speak, we always do leave open spots during our schedule during the day, certainly for emergency appointments and things like that. But I think that
right.
does get at what the question is. So we will prioritize kittens because we want kittens in because we know they're going to come in and be out within a few days. And we want to get that kitten sterilized and on its way before it, starts turning into an adult cat, which isn't as highly adoptable as that kitten. So I think while we don't have a wait list, we still do try to manage that because, again, we want to capitalize on these cute little fuzzy kittens while we can because we know they're going to fly out the door as soon as they get in.
That makes perfect sense. So here's the next question. When people come in with strays and you talk them into keeping the animals temporarily, are they treated like a foster family? We have lengthy foster forms for people to fill out. If they're a walk-up, and I don't know if we could convince them to fill the forms out.
Maybe you need to look at your foster form if it's lengthy. Make it, I'm always for making things easier for the public. The easier we make it, the more of them will join us in our work.
I agree, and we don't have them fill out any forms. We don't really necessarily treat them like a foster family. They're a finder of an animal, and instead of bringing it to us, they're just electing to keep it. So we just support them with whatever way we can, but we put up no barriers to that. So we offer them resources, but we do not ask them to fill out any forms. We don't even honestly require that they bring the animal back to us. We're there for a resource for them, but again, if they can rehome that animal, if they decide to keep that animal, that's ideal in our words. So we try to remove as many barriers as we can and just try to partner with them, to help us out while we can't take this animal.
There are times if it's a litter of 2 young kittens, we may formally turn them into a foster home so we can make sure that those kittens get sterilized and vaccinated in a timely manner. And so there are times when we do turn the strays into foster homes, but we really try to make it as simple as possible for someone to be a foster home.
Very good. This question is a little different. How do you handle customers that want to surrender a cat because it is FIV or feline leukemia positive when their vet has counseled them to destroy the cat? Do you test?
Do we test?
Yes, do you test? Yes. Well, that's part of my question with this question, yes.
Yeah. We do test. And if this looks like it's an emergency situation, as Kathy said, we always make room or have room for the unexpected. So if a cat has to come in, we're gonna take it in.
And I'll add that I think the question is if the cat is showing signs of the illness. So it's one thing, as Barbara's saying, if the cat is in distress and it's sick, that's one thing, and we would accept that animal. If the cat is healthy and is positive for the disease, but yet it's healthy, I think we would counsel that person that, in our organization, we are successfully placing cats that are positive with leukemia and FIV. They certainly don't have a fast length of stay, and it's a select people that want these cats. But I think that we would actually counsel them and try to help them understand that this cat could be adoptable. Again, if it appears healthy and it's not showing any signs of the disease, we would counsel towards considering bringing that animal and placing it in for adoption versus euthanizing it.
Yes, and I would say we would do the same. But I think our first shot would be to counsel them to keep it.
Agreed.
Okay, great. Here's another question. Do both organizations have on-site veterinary clinics? Question for both. If they do have vet clinics, do you provide free or reduced cost vet care while the person is waiting to place the animal at the shelter?
I would say yes to both of those.
And in Minnesota, we as the shelter are not allowed to provide veterinary services to the community. We have a Veterinary Practice Act that we have to follow, so we are not able to provide services to the animal unless the animal is actually surrendered to us. We do have resources. We partner with a affordable spay-neuter clinic. There's other resources in our community, so we try to convince people to go to those, but we can't actually provide those services ourselves.
We have the same in New York State, but we just sign the animals in and then sign them back out.
Ah.
So those 280
excellent.
cats that we sterilized last year, we signed those in as SPCA cats and then adopted them back at no charge.
Very good. Great idea. So here's another question, and we'll take one more question after this, and then we'll wrap up with closing remarks from Dr. Julie Levy. For people who call with a cat problem or wanting to surrender a cat, is there any kind of online form to be filled out? Is any kind of phone interview conducted? I think you both said that you interview by phone, but are there forms that they can fill out before they come?
I think, Kathy, you have forms, right?
Say that again?
I think Kathy has forms. We do not.
Yeah, so we don't have, the actual phone interview or the actual initial interview is only by phone. What we have people fill out is like a profile, just gathering information, likes, dislikes about that animal. But everything is done, the scheduling of the appointment and that conversation is all done by a phone interview before that appointment is scheduled.
Okay, great. And this is the final question before we go into our ending comments. How long did it take to transition to this new model? Barbara?
As I recall, not very long. We sort of had been hearing about it, thinking about it, talking about it, but rejecting it until all these cats died of panleukopenia. And that was in August, I believe. And I'm pretty sure we were up and running with this by October 1st or 15th of that year.
So we had a little different experience. It was something that we knew we wanted to do, but again, having 5 shelter locations, nothing happens quickly in our organization. So we actually worked on the process and designed our rooms and, put together, our resource center. We did all those things. And I would say it took us about a year for that entire process. And again, I know that sounds like a long time, and it is, but when you have 5 different shelters, and we were creating evaluation rooms, and we had to train staff to, actually do those evaluations at the time. So it was a little bit longer of a process for us. But I will share that we have never looked back and never regretted any of the time or the financial investment or anything that we've done. This has been nothing but a positive adventure for us, and we wouldn't trade anything for the world.
And I just want to say the same thing. Do it. You will never be sorry that you did this thing for cats. Never.
Agreed.
I think you've both convinced those other, what was it, 8%?
8.3.
8.3. Excellent. Dr. Levy, do you have any comments for the audience before we close for the night?
I do. I just want to echo the sentiment that what I keep hearing from shelters that are moving in this direction is that their only regret that they had after making this choice was that they didn't do it sooner, and thinking about all those cats that could have been helped better had they adopted these new policies faster. They're excited because by managing their admission, they have room in their clinic to take care of animals that they couldn't have taken care of before. The staff is rested and energized and excited. They don't have isolation full of sick cats that had come into the shelter healthy, and that they're literally flying out the door and getting adopted. In addition, the shelters that are doing managed admission and working within their capacity for care also have more opportunity to respond to emergencies. So, for instance, when that hoarding case does come along, it doesn't cause total chaos or cause a need for more euthanasia in the shelter to make room because they aren't overcrowded in the first place. So I encourage everyone to give this a shot. You can start little with a pilot project and one idea, or you can start big and just go for it all and have the whole transition happen all at once. And most of the time what I'm hearing is shelters are really excited just to do it all at once. There's a lot more detail on our Million Cat Challenge website, which is millioncatchallenge.org, where you can see sample forms and more examples of how exactly this is working. And for our audience members who actually are shelters, if you have not yet joined the Million Cat Challenge, please go to the website and sign up. And we invite our shelter participants to join a Yahoo website where you can communicate with other shelters that are already doing this to get more details of the tactics that are making it successful.
Very good. Thank you. Thank you, speakers. That's the end of our event tonight. We want to thank Barbara, Kathy, and Dr. Levy, and all of you for your time tonight. We invite you to take a few minutes to complete our survey. Your feedback is important to us. Click on the link on your screen. If for some reason you don't see the link, it is also in the resource file at the bottom of your screen. And the link will be emailed to you in a few days. This webcast will be available on demand shortly, and we hope that you will share this presentation on your social sites. We hope you can join us for the remaining 3 webcasts of the Million Cat Challenge key initiatives that will help change the sheltering world. Thanks again for being here with us this evening, and good night.